Welcome to True Health Tuesday, and the truth will set you free. As part of our stress series, we're going to start on physical stress. Now, this is huge. Now, when you think of physical stress, you're going to think of slips, falls, traumas, straining your body. Okay, great. Okay. Sedentary lifestyle is a physical stressor, and this is huge. Your body needs to move. Now, the results, the effects of a sedentary lifestyle: increase of all types of cancer, cardiovascular disease, depression and mood disorders, Alzheimer's, dementia, cognitive decline, type 2 diabetes, erectile dysfunction, deterioration of your spinal health. Hugely negative. Also, excessive exercise is a stressor. When you're looking at marathon running, you're looking at a sevenfold increase of cardiac risk. Excessive exercise decreases testosterone, decreases immune system, breaks down muscle size and strength, increases cortisol production, increases free radical production. Now, traumatic injuries are a physical stressor, but all of these physical stressors initiate a stress response. So, what does that do? It starts to have the liver break down glycogen to glucose. The blood becomes thicker, increased viscosity, heart rate increases, and blood supply to the gut shuts down. So you're looking that this is your entire system goes into this fight or flight state. That means that the sympathetic is firing off and parasympathetic suppressed. So your body's ability to regenerate tissue is compromised. Now, the effects of chronic stress, you're looking at diminished utilization of glucose. So blood sugar levels go up. Protein synthesis breaks down, muscle wasting, osteoporosis, problems with skin regeneration, diminishes lymphocyte numbers. It's crazy. Now, I'm going to describe the how stress kills, and this is one of the mechanisms, okay, that we look for. If you look at this, physical, chemical, emotional stress are going to have the same effect on the body. Now, everybody knows, and this has to do with the embryologic origin of the diaphragm and trapezius. If you irritate the diaphragm on the left trapezius spasms out. And that means if you have a cardiac issue, you're going to left shoulder, left jaw, left arm pains. Okay, and everybody knows that. Those are signs and symptoms. What people don't know, and this is what we're taught in chiropractic school, and a lot of physical therapists are taught as well, is right-sided shoulder spasms could be referred from gallbladder and liver issues. And figure under any kind of stress, your body excretes epinephrine, norepinephrine, cortisol, and those stress hormones have no off button. They have to go through the body and do their action. Then they're filtered from the spleen to the liver. So the liver's got to work harder. This is why the liver is also called the emotion organ, but also right-sided trap spasms as well. Now think of this: physical, chemical, emotional stress. Your liver's got to work harder to process these, and the right trapezius spasms out, increase tone. Now the center of that trapezius is located at the top of the thoracic area, and T1 through T4, the top four bones in the thoracic, are also the sympathetic nerve supply to the heart. So physical, chemical, emotional stress, that muscle increases in tone. Eventually, it stresses that system out so much that the body fires a sympathetic charge down to the heart, putting the heart in ventricular fibrillation, stopping the heart. This is why when we look at x-rays and we see a structural deviation at the top of the thoracic area, I asked, do you ever have any AFib, atrial fibrillation, cardiac arrhythmias, heart palpitations? Because all of those could be a contributing factor if you see a structural deviation there. And then when you see a chronic stress state, man, that clues you in. This is why when you're looking at all of the stressors to see the evidence of physical stress on the x-rays, that's the key. Now, the central nervous system is so important, it's encased in bone. You got the brain and spinal cord, and the spinal cord is a flexible tube. Understand that the nervous system controls and coordinates every function of the body. In fact, from embryologic origin, all the organs grow off of it like fruit on a tree. So if you have a structural deviation in that area, you could compromise the nerve supply to that organ, and that can negatively affect how the organ functions. But also, any area on there, if it puts you in that fight or flight state, you're going to alter how each one of those organs function. That's why when we're looking at those vertebrae, we're looking at position, motion, communication, and health. It's vital for every structure. Now, Dr. Chung Ha Su from the University of Colorado studied subluxation. And what a subluxation is, it's a vertebrae misaligned in relationship to the vertebrae above and below, affecting the nervous system. And this can alter your physiology, put you in that stress state. Quote, if subluxations are not corrected early, when they are caused shortly after birth, the subluxation will be difficult or impossible to correct later. Subluxations can reduce nerve impulses by 60%. That's huge. Do you want 100% life or 60% life? And this is also why when people ask me, when's the best time I should bring in my kids? And I say, well, you can wait till they get really sick and then drag their body in, or we could check them now. A couple of days ago, I just adjusted the most beautiful, angelic 3-week-old baby. I mean, she was so cute. And very, very fussy. So I showed the parents how to check the kid. And I actually grabbed the parent's hand and put it on the child's sacrum. And I say, feel this, feel this. And so I'm using the parent's hand to adjust that little beautiful 3-week-old infant. It's fantastic. And they were amazed because the kid instantly calmed down. No kidding. I mean, kids are important. Now, when you have a structural deviation, a physical stressor, there's a series of events that happen. Number one, the movement is altered, and that's called a kinesiopathophysiology. Now, if the movement's altered, that can affect the nerves. It's going to affect communication to the cerebellum. It's going to affect the brain function. It's going to affect everything. So that's a neuro or nerve pathophysiology. Then you have all the muscles tightening up to protect that area. Now, the muscles on either side of the spine, they're called postural muscles. So they're not under conscious control. So when people have chronic tight shoulders, chronic tight neck, chronic spasm in the low back, okay, those are postural muscles. So then you have the myopathophysiology. So you got movement, nervous system, and the muscles. Then if those muscles are in spasm and the structures are misaligned, you literally have change in the tissue. That's the histopathophysiology. And that tissue can change. The ligaments start to become stiffer. The muscles start to excrete lactic acid. I mean, all the structures change. And then you have the pathophysiology. And this is when you have destruction of the tissue or pathology. So understand that at first you've got the movement misalignment, but you do not have symptoms. Only 10% of the nerves that come out the spine have pain fibers. 90% don't. So this is why we don't ask how you're feeling. Okay, how you're feeling may bring you in the office, but it's not a good response or gives us good information. This structure is beautiful. You have natural curves from the side. You have natural, and you should be straight up and down. So any structural deviation is going to alter that function. That's why when we talk about physical stress, you got to identify it. Any physical stress is going to alter communication to the brain. It's that simple. And then that brain controls the body through the nerves. So you're altering input into the brain and you're altering the brain's control of the body. Now, discs, healthy discs require movement. And you figure a disc is under a huge amount of force loading, and a disc is 80 interconnecting rings of ligament. And they have a horrible blood supply because they're under such compressive forces. They get their nutrients through imbibition or through movement, and that allows fluid to flow into the disc. And so this is essential. Like if you have alteration in position, you have alteration in movement. Then the disc becomes compressed. Then the body, to stabilize that unstable segment, will change the shape of the bone in order to stabilize it. This is why when people say, oh, it's the bone spurs that's hurting me. No, it's not. Okay, you had an alteration in position and motion of the vertebrae that altered the nutrients to the disc. The disc got compressed, and then the bone spurs developed to stabilize an unstable segment. Now, this is called osteoarthritis. Now, arthritis means joint inflammation. Osteoarthritis is a non-inflammatory joint inflammation. I know. Try and wrap your head around that. It's in a joint inflammation category, but it's non-inflammatory. And then it's also called degenerative disc disease or degenerative joint disease. Here's the thing. It's not a disease. It's literally from trauma. So when you're looking at these two pictures here, the one on the right, literally you're looking at 30 plus years of adaptation to a chronic state of stress. Now, MRIs, I'm not a big fan of, okay, only because they're going to MRI the area of symptoms. And an MRI, you're laying on a flat plate, gravity is pushing down, the table's pushing up, you got a magnet spinning around your body, creating a high magnetic field, and all the hydrogen ions face in one direction, then a computer's got to interpret it. So body position is going to change it. The inflammation can change it. And also, think of this. Okay, if you're sitting up straight, keep your shoulders level and slide your body off to the side. And just stay here for a minute. Where do you feel it? Typically, you're going to feel it in the low back. So if your entire torso has been shifted off to the side for years, you're not feeling it up here. You're feeling it in the low back. So then if they MRI the low back, they're going to say, that's it. It's a disc injury. Really, what caused it? Because discs are alive. Discs are literally alive. So if you find the reason that disc malfunction, because discs are tough, they require altered mechanics for a long time to herniate. So you have to identify the entire structure to see what the force loading on that disc is. Hugely important. Now, the curve in the neck is called the arc of life. My boat is called the Arc, A-R-C. and it's huge. I mean, just when you look at this, a normal neck has a beautiful curve. Now, the brain doesn't stop at the skull. There's an oblong section of the brain that extends the top portion of the neck. And that's the cardiac and respiratory center, cranial nerves, everything. So in a loss of curve, that area is under pressure. Now, a little bit lower in that is the nerve that supplies the diaphragm, C3, C4, C5. So from the middle of the neck down, that's the breathing muscle, the diaphragm. So if you have a structural deviation, you're talking you could have altered diaphragmatic function. Then at the base of the neck, all the nerves that supply the upper extremity. So you're looking at shoulder, elbow, wrist issues. They used to call them a carpal tunnel, golfer's elbow, tennis elbow, and rotator cuff problems. They used to call them double crush injury, where you damaged the area in the nerve, and this negatively affected the periphery. So you have to look at the nerve supply. So if you've had chronic shoulder issues, chronic wrist issues, chronic elbow issues, look at the source. Have them take a picture of the rib cage and neck. It just makes sense. For every 1 inch that heads forward, the pressure on the disc double. Now, is the body smart or is the body smart? I'm only going to give you one choice here. So for every 1 inch, the pressure on the disc double, instantly the muscles that you don't have conscious control, the muscles that run from the base of the skull down to the top of the sacrum, they're called postural muscles. These muscles are going to fire off to reposition that. Now, if you relax these muscles, which way does the head go? Bam, further forward. This is why when we have patients come in and say, all I just need is a massage. Well, let's find out why the muscles are firing, because I don't do massage. I do corrective care. Now, you've got to look at the structures of the patient, because even somebody that's been born, okay, let's say the mom's been given Pitocin or an epidural or had a traumatic birth. Even infants can have a problem with their structure based on a traumatic birth. So, and this is why I ask about ear infections. I ask about inflammatory bowel disorders. I ask about a lot of things that can occur from some type of trauma. And that curve in the neck, you got to figure anxiety, stress, depression. These are all features of the frontal lobe. That frontal lobe gets its input from the cerebellum. Where does the cerebellum get its input? From the position and motion of the vertebrae. So if you have a reverse curve in the neck, not only is that pulling on the brainstem, it's limiting the flow of cerebral spinal fluid. That brain is unique. It makes its own food called cerebral spinal fluid. It's encased in a structure. And if that fluid, which is supposed to give nutrients to the brain, and flow down and give nutrients to the spinal cord, a reversal of the curve is going to limit that flow. It's going to limit the nutrients to the brain, and it's going to cause abnormal stimulation. So when we have somebody with anxiety, stress, depression, we're not working on those. We're looking at the input into that brain that may be a contributing factor. Wow. And then you also have to heal the gut where neurotransmitters are. So a physical stressor has to be addressed if you've been diagnosed with those conditions. Look at this before and after. Before, we're looking at an abnormal upper thoracic area. This is why any patient with an issue like this, I'm going to say, do you ever get those flutterings and then you take a deep breath and it goes away? If they say no, beautiful. If they say yes, look, I may have found the source of this. So it's not a design to motivate people out of fear, but it's just to give them assurance that their body is responding correctly. And the reason I like doing post x-rays, because you got to see that you're actually fixing the problem. If you're not, you got to change your technique, or you got to ask the patient what kind of biomechanics they're doing throughout the day, because you've got to show the body getting corrected. So what kind of things can you do? Because you got to find a corrective chiropractor. I've got these 7 questions. The 7 questions are really clear. You only need to find a chiropractor that says yes to 5 of the 7 questions. And then you got a good chance of finding somebody that's going to find and correct the problem. Number 1, do you take x-rays? Okay. Why? Because you got to look for the structure. You can't feel them. No one's able to palpate a 20 or 10 degree deviation. You can feel muscle spasms. You got to know what you're working with. Then do you get listings, or are you utilizing the x-rays to guide your care? And a lot of people will take x-rays because they can bill for them. Okay. Now, utilizing the x-rays to guide your care is a good idea. Question 3, do you take post x-rays to document the structural changes made? Brilliant. Okay, this is like from Missouri, the show me state. Show me that you're actually fixing the problem, because I need to know. Figure 90% of the nerves come off the spine, there's no pain fibers. So if you have an adjustment where the person has pain and then they don't have pain, did you actually fix the problem? Or are you just changing their symptomatology? You've got to document, take an objective analysis to check that area. Then, are your treatment goals to reshape and restore the natural curves? Hugely important. Remember, 10% of the nerves that exit the spine have nociceptive firings or fibers, and that means that they gauge pain. 90% don't. And so if you're just treating somebody for symptoms, which is okay, that's fine. But the difference between a chiropractor to deal with symptoms to get you to feel better, which is great, largest drugless profession on the planet. But how about we document those structural changes? And your goal is to reshape and restore the curve. So beyond symptoms, you're fixing and preventing future injuries. And 5, are you familiar with correcting disc injuries? And that is huge, because you got to figure discs are alive. And if you understand, go back to that experiment, keep your shoulders level, sit up nice and straight and slide off to the side. Where do you feel that? You feel that in the low back. So if you're only working on the low back and you're not paying attention to why that disc is under an abnormal force loading, you've got to restore the position motion. That's why if somebody comes in with a low back disc, we're going to look at the pelvis. We're going to look at the gait. We're going to look at their knees. We're going to look at their feet biomechanics. We're going to look at their torso. We're going to see if there's forward head carriage. All of this. Your goal in correcting disc injuries is to find out why it's there and then know that you can reposition most discs. Then 6, do you work on post-surgical patients? You have to. You cannot work on the site of injury. You can't work on the fusions or the plates or the bolts. Okay, but you got to work above and below, because you've got these mobile segments of the spine. When you fuse that area, the area above and below got to move twice as much. And that means their biomechanics is altered and they could wear out more. So you've got to pay attention to that. And then 7, can you reverse arthritis? Remember, the most common is osteoarthritis. It's also called degenerative disc disease. And it's not a disease and it's not inflammation. It's from a trauma. And if you take a body that's been traumatized and you correct that trauma, then the body can regenerate in a healthy configuration. It's really that simple. And if you're doing pre and post x-rays, you're going to see that. Now, this is a very, very high level. This is corrective care. And it doesn't mean that people that practice this are better than others. It's like the difference between a dentist and an orthodontist. It's just utilizing an objective analysis to document that you're actually fixing the problem. I like. And this is why the 5 keys to healing. When we're talking physical stress, does this affect the nervous system? Absolutely. Regular exercise, does that help the entire structure? Absolutely. It actually changes how the brain works. Proper nutrition. This means if man makes it, you're not eating it. Your diet should be like your great great grandparents. They eat nothing but organic, healthy, free from preservatives, fermented. Fantastic. The planet was built for you. So, eat the stuffs that come from the earth, not the genetically modified stuffs. Now, sufficient rest. This is when your body regenerates. And prayer and meditation. This planet was built for you. You're made in the image and likeness of God. And if you don't understand that or have a different belief system, look at the studies. Look at an objective analysis. Every study involving prayer in healing occurs faster. Why not utilize that? Plus, it's fun to have a relationship with God. God bless you, my friends. Stay healthy. Also, at the end of this, put your questions. We're going to, any questions that you have, we're going to try and get to all of them. We may have to divide them up into topics that are censored and the uncensored topics. So they may be on a couple of different sites. But God bless you. Put your questions below, and we'll get to as many as we can.